Holy smokes, it's been quite a week in Oregon, and we're here today to give an update on COVID-19. I'm joined by Patrick Allen, Director of the Oregon Health Authority, Dr. Dean Seidlinger, our state epidemiologist, Joan Watson-Patko. She is Executive Director of the Oregon Primary Care Association, and Sarah Dynas, Director of Quality at the Virginia Garcia Memorial Health System. I wanted to start this morning by addressing the severe winter weather of the past week, which left hundreds of thousands of Oregonians without power across the Willamette Valley. Utilities in our region have experienced severe, widespread outages. One week in, more than 70,000 Oregonians remain without power. I know this has been really difficult. And I also know that on top of the ongoing pandemic, many Oregonians faced a difficult choice: warmth or safety. To choose the warmth of staying with friends or family in a powered home, or to remain home without heat and light, but safer from gathering indoors with people outside your household. We all do the best we can for our families during these tough circumstances. If you did shelter with family or friends and experience COVID in the coming days, please test and isolate until you know you're healthy. I also want to say thank you to our local and state workers, first responders, and utility crews who continue to work around the clock to restore power and aid our families in need. I declared a state of emergency over the weekend to ensure state resources were made available to help crews on the ground. I've also made the National Guard available to help impacted counties with county emergency management in door knocking and wellness checks. I encourage folks to check on your neighbors, especially if they're elderly or vulnerable. Oregonians always come together in moments of crisis, and I know this past week has been no different. Even in the midst of historic power outages, we've continued pushing forward on our efforts to fight COVID-19, vaccinate Oregonians, and return more students to in-person learning. Oregonians continue to make smart choices, and the numbers speak for themselves. As of yesterday, Oregon had the third lowest infection rate in the entire nation. And while this is great news, we must remain vigilant in the face of challenges ahead with the new variants. We are still learning about these new variants and how they might impact community spread and illness. As such, we advise Oregonians to continue to follow safety measures and choose your activities wisely so that you are minimizing risk as best as you can. On the education front, there's some good news. When I made my announcement in December amid the winter surge, many thought in-person learning was far beyond reach. Since then, again, thanks to the smart choices of Oregonians, our case rates, hospitalizations, and deaths from COVID-19 have steadily declined. And even our largest school districts, including the Tri-County area today, meet or exceed Oregon's advisory school metrics for hybrid in-person instruction. Our infection rates are low enough that there are now 19 counties meeting or exceeding the advisory metrics to return for on-site or hybrid learning. I'm also pleased to share that we now have more than 130,000 students back in the classroom. That's about 20% of our state students, and more than double what it was 8 weeks ago when I directed the Oregon Department of Education and the Oregon Health Authority to put more schools on track for in-person instruction. I'm also pleased to report that more than 600 schools across the state are now open for hybrid or full in-person learning. Communities and school districts across Oregon are working collaboratively to return students safely to the most effective learning environment. Our kids will benefit greatly from these efforts. All educators who want a vaccine will soon be fully vaccinated, but we also see over and over the clear science that with rigorous health and safety protocols in place, schools can safely reopen. It's my expectation that more schools will bring students back for in-person learning over the coming weeks, and I will continue to do all I can to help make this a reality for our kids. I want to end by thanking every grandchild, son, daughter, neighbor, and friend who has helped our older adults register for vaccine appointments, driven them to vaccine sites through snow and ice, and supported them throughout the pandemic. Director Allen will share more progress that we've made in vaccinating seniors. But before I turn it over to him, I invited a dear friend of mine to join us today. Many of you know Senator Margaret Carter, the first Black woman elected to the Oregon legislature. She's 85 years young and was thrilled to receive her first vaccine shot earlier today. I asked her to share a few words about her experience.
Hi, I'm Abby from OHSU. We're super excited to have former State Senator Margaret Carter here, an amazing community leader. And are you ready?
I'm ready.
All right, let's do it.
And you know, Abby, one of the reasons I'm so ready is because I want our community to know I am taking this shot and it's safe. And even though we have a history of government intervention, because we go back to the Tuskegee days, but I want our community to know that this is safe, and I want you to join me in taking this shot.
Thank you so much for being here.
You bet.
All right, let's do it.
Okay.
Okay. Give you the Pfizer vaccine. All right, so I'm going to just have you rest your arm right up here.
Okay.
Keep it nice and relaxed.
All right.
Loosey-goosey. Sorry, my hands are so cold.
Oh, I'm ready.
All right, my
I'm
dear.
ready.
So you're just going to feel a quick pinch. Ready?
Okay.
1, 2, 3.
All right.
And you're done.
My God, Danelle, it didn't even hurt. Oh my God, you gotta take this shot.
So easy. All right.
Okay.
Thank you, Senator Carter, for sharing your vaccine experience. And now back to you, Director Allen.
Thank you, Governor Brown. Again, I'm Patrick Allen, Director of the Oregon Health Authority. This morning, I want to give you an update on where we stand in our COVID-19 vaccination efforts and talk to you about steps we're taking to address health inequities we see emerging in vaccination trends in Oregon. As Governor Brown mentioned, I'll be joined by our guests representing federally qualified health centers in Oregon, who will talk about vaccinating people that our healthcare system has failed to serve and whose communities have unfairly experienced preventable health disparities, such as shorter life expectancy as a result. I'll also be joined by Dr. Dean Seidlinger, who will talk about the latest COVID-19 forecast. Here are 3 things I want Oregonians to know about our progress in the state's vaccination rollout. First, Oregon's vaccination timelines remain on track despite the weather. Snow and ice canceled clinics and delayed vaccine shipments over the past week. However, we don't expect these problems will have a long-term impact on our vaccination schedule. Second, Oregon remains on schedule to open vaccinations to people 70 and older on Monday, the 22nd, and to people 65 and older on March 1st. I want to reassure every Oregon senior, nothing that's happened in the past week will slow down our schedule. And third, OHA is committed to interrupting the widening racial, ethnic, and other inequities we see in vaccinations throughout the pandemic. OHA is taking steps to close those gaps. But let's look at our current numbers. As of yesterday, February 18th, Oregon vaccinators have administered 755,657, almost 750,000 first and second doses. Over 500,000 Oregonians have received at least their first dose. Oregon is tied with 17 other states at 12% of our population vaccinated. The national average is also 12%. Oregon has completed 2-dose vaccinations for 233,276 people. Overall, 5% of Oregonians have been fully vaccinated, which puts us slightly ahead of the national average, which is 4.9%. At this stage in our rollout among older Oregonians, 95,021 Oregonians aged 75 and above have received at least 1 dose. That's 32% of all currently eligible seniors. 152,511 people aged 65 or older have had at least one dose of the COVID-19 vaccine. That's 1 in 5 seniors. Over the past 7 days, we know that severe winter storms have disrupted life across Oregon. I want to express my recognition of the tens of thousands of Oregonians who've endured cold days, dark nights, spoiled food, and prolonged discomfort and inconvenience due to a loss of power. I also want to express my admiration and appreciation for all the crews who've worked long hours through icy conditions to restore power to homes and businesses. It seems like every season brings a new test on top of the pandemic. Oregon's vaccination clinics were no exception. Over the past week, weather forced clinics to cancel and reschedule appointments or open late. Our weekly shipment of 67,000 Moderna vaccines didn't arrive because of storms that interrupted vaccine deliveries nationwide. Even this weekend, some clinics have been forced to cancel operations because their scheduled shipments were held up by the weather. But like previous tests, we've rebounded from this latest trial, and so the nurses and other healthcare workers who are administering Oregon's vaccines. Over the past week, Oregon averaged more than 14,000 vaccinations per day, despite the battering the state took from a historic set of storms. Oregon vaccination sites reported administering more than 22,000 vaccinations on the Wednesday and Thursday immediately prior to the first storm. Yesterday, vaccination sites reported 18,711 vaccinations in their first day of reporting, and we know that number will climb as more sites report their numbers over the next 48 hours. More good news. We're continuing to receive increased vaccine supplies from the federal government. This week, the administration announced the Federal Retail Pharmacy Program, which launched last week with 127 pharmacies across Oregon, is ready to expand as vaccine supply increases. The 12,700 doses for that program will continue to flow to individual Safeway, Albertsons, Costco, and Health Mart retail pharmacies. An additional 12,800 doses of Pfizer vaccine are set to arrive next week to support expanded vaccination opportunities. This new weekly allocation brings the total number of doses being delivered via the Federal Retail Pharmacy Program to more than 25,000 per week. These additional vaccine doses will enable us to both expand access to appointments at retail pharmacies as well as support mass vaccination events. CDC is doubling the amount of doses it sends to federally qualified health centers, or FQHCs. That means another 6,000 doses for Oregon. Starting next week, we expect Oregon's total allocation to grow from 83,000 doses to approximately 107,000. We appreciate our federal partners expanding vaccine supplies. We know Oregon has the capacity to administer more doses than we have on hand. In recent weeks, we've seen days where Oregon vaccinators have exceeded 25,000 shots delivered. We have the capacity to administer many more doses than we're currently delivering, and we're enrolling more vaccination sites, such as Walgreens. As the slide shows, the trajectory of our vaccine allocations hasn't changed. We're keeping our commitments to seniors. If you are between 70 and 74 years of age, you will be eligible to get vaccinated beginning Monday, February 22nd. If you are between 60 and 65 and 69 years of age, you will be eligible to get vaccinated beginning Monday, March 1st. But I want to ask people who are newly eligible the same thing I've asked everyone who's come before them. Please be patient. Vaccines remain limited. We're getting more doses, but we still don't have enough to vaccinate everyone on demand. And while it's an encouraging sign to see that we've vaccinated nearly a third of all currently eligible seniors, even taking into account the weather-related disruptions, we know it will take some more time before we have enough doses to vaccinate a critical mass of everyone who's currently eligible. Now, I want to talk about one aspect of Oregon's vaccination program where we're not on track: racial and ethnic inequity in the pandemic and in vaccination rates. The COVID-19 pandemic has affected everyone in Oregon, but it hasn't affected every community in the same way. Across the country, communities of color, which had already experienced unfair disparities in health outcomes and access to healthcare, have seen those inequities compounded during the pandemic. In Oregon, the Latina community has seen the most pronounced inequities compared to non-Hispanic whites. People who identify as white represent 75% of Oregonians. However, while they only comprise about half of COVID-19 cases, they account for 74% of vaccinations. People who identify as Latino or Hispanic represent 13% of Oregonians. However, they comprise 26% of COVID cases, twice the proportion of the population. Despite the disproportionate burden of COVID-19 cases the Latina community has borne, they account for only 5% of the vaccinations administered to date. The numbers are a bit different for other historically underserved communities in Oregon compared to the nation. In Oregon, people who identify as African American are 2% of the state's population, and they represent 2.4% of COVID-19 cases. They represent under 2% of COVID-19 vaccinations. Native Americans comprise close to 2% of Oregonians. They also account for close to 2% of COVID-19 cases and 2% of COVID-19 vaccinations. It's important to keep in mind some additional factors. First, our vaccination data isn't clear-cut. People can identify as 2 or more races, and many vaccinated patients identified as other race or unknown. Second, we know that vaccines are an important tool in reducing severe illness and death, which is why we're paying close attention to the inequities in underlying health conditions which could make COVID-19 more severe. Due to a history of unfair treatment, systemic racism, and uneven access to healthcare, Latinos and Latinas, African Americans, Pacific Islanders, and Native American communities are burdened by significant health inequities that enhance their risks from COVID-19 and partially account for disparities we see nationally. For example, African Americans with diabetes often die earlier than their white counterparts with diabetes, losing an estimated 35% more years of potential life due to premature death from diabetes. Latinos are 13% more likely to have diabetes than white Oregonians and have lower life expectancy with the disease than other races. Due to a variety of factors, including a history of toxic stress and genocide, American Indians and Alaska Natives are 43% more likely to have coronary heart disease and are more likely to die a premature death compared to whites. I want to be perfectly clear. Health inequities are the product of systemic racism, toxic stress, the targeted marketing of harmful products like tobacco and sugary beverages, and other factors. This is not about personal choice. This is about the weight of larger social inequities that cut short lives and opportunity more often for people in communities of color. Not every state reports vaccination data by race and ethnicity, and Oregon's data is certainly not as complete as we'd like, but OHA is paying close attention to these numbers. At a minimum, we need to ensure our vaccinations proportionately reflect the faces of our communities, but we want to do more. Our COVID-19 efforts should be a model for how we're eliminating health disparities in Oregon. I'm grateful that Senator Carter was willing to share her experience getting vaccinated and her thoughts about what vaccines mean to our communities. At OHA, we're working to build bridges with communities our healthcare system has failed to serve well, improve access to vaccines and other healthcare, eliminate health inequity, and enable more people to live a healthier life. Federally qualified health centers are a cornerstone of healthcare in many urban, rural, and remote communities. Working with FQHCs is at the core of our effort to eliminate COVID-19 health inequities. That's why I talked about how Oregon is prioritizing FQHCs for vaccine allocations at our news briefing last week. FQHCs have been vital partners in Oregon's response to the coronavirus pandemic. FQHCs provide high-quality clinical care. They've offered telemedicine and made other changes to ensure patients can stay safe when they seek care. FQHCs serve people who work in jobs that are most at risk. They've set up testing sites for their patients and the wider community. FQHCs are vital vaccination partners because they can reach people who are vulnerable to COVID-19, but also may experience higher barriers to getting vaccinated at large centralized settings. FQHCs are the trusted providers for many people who are uninsured, disabled, or lack reliable transportation. They're a preferred option for people who may be wary of large institutions and law enforcement. And they have credibility in their communities at a time when disinformation about coronavirus vaccines is rampant on social media. With that, Governor, I'll go ahead and turn it back to you.
Thank you so much, Director Allen. I am now going to turn it over to Dr. Dean Seidlinger, our state epidemiologist. Dr. Seidlinger.
Thank you, Governor Brown, Director Allen. Let me start by providing a brief update on the pandemic in Oregon. We continue to see overall declines in daily cases, hospitalizations, and the rate of testing positivity for COVID-19. This is a testament to the hard work of all people in Oregon in responding to the pandemic. Thank you. To date, the Oregon Health Authority has reported 152,190 COVID-19 cases in Oregon, including 492 today. The 7-day rolling average for daily cases stands at 393 as of yesterday, a 66% drop since the beginning of the year. Weekly cases also declined. For the week of February 8th to the 14th, there were 3,453 new cases recorded. COVID-19 hospitalizations are also dramatically lower. On January 2nd, we reported 466 virus-stricken patients in our hospitals. Yesterday, there were 190, a decline of 59%. The percent of positive tests dropped to 3.4%, the lowest since the change to the test-based method in mid-November. COVID-19 associated deaths have also fallen from their peaks in December. To date, there have been 2,149 COVID-19 related deaths in Oregon. This pandemic has taken so many people from their families and their communities. Yesterday, we reported the death of an infant who tested positive for the virus and died the same day. Every death from COVID-19 is a tragedy. No parent or family member should have to suffer such a grievous loss. The death of such a young child is extremely rare, and children infected with the virus are much less likely to develop severe illnesses compared to adults. But this is a sobering reminder of the danger of COVID-19 the danger of COVID-19 poses to all of us. The downward data trends in cases, hospitalizations, and percent positivity reflect the shared sacrifice of Oregonians and the collaborative efforts of Oregonians to protect their families and their communities by wearing masks, limiting indoor gathering, and keeping physical distance. You are making a difference. Thank you. Our recent modeling affirms the results of that hard work and lays out the delicate balance needed to sustain our success. We estimate that the transmission rate of the virus increased slightly from mid-January to February 3rd, with an estimated reproductive rate of 0.88. If that level of transmission holds, we can expect further declines in daily cases to an estimated 320 and a decrease in daily hospitalizations to about 10 between February 24th and March 9th. However, if a more contagious variant becomes dominant, or if we relax our vigilance, especially as more counties see their risk levels reduced and our transmission rates climb above 1, we can expect an estimated increase in daily cases to 510, with 17 new daily hospitalizations. The forecast also notes that some among us may be more open to resuming activities that pose a higher risk of spread, especially as spring and summer approaches. The virus has proven to be a stubborn foe, but each of us possesses the tools to ultimately defeat COVID-19 by continuing to follow the protective measures and getting a vaccine when it's your turn. We have come too far to jeopardize our hard-won progress to let up now. Every setback puts us further away from putting an end to this pandemic. I want to conclude by acknowledging the emotional strain brought on by events over the past year. From the impact to this pandemic due to the devastating wildfires and most recently the historic ice storm that caused widespread power outages throughout the region. Oregonians support one another in their communities. We are resilient. We persevere. Thank you for all you have done to support your families, loved ones, and communities. Because of those characteristics, Oregon has avoided the fate of many other states suffering from the COVID-19 pandemic. That should be a point of pride for each of us. And with that, I'll turn things back over to Governor Brown.
Thank you, Dr. Seidlinger, and thank you for your incredible hard work over these last several months. Next, we're going to turn to Joan Patko-Watson. She's the Executive Director of the Oregon Primary Care Association. Joan, the floor is yours.
Thank you. Good morning. I'm Joan Watson-Patko, the Executive Director of the Oregon Primary Care Association, a nonprofit membership association of Oregon's 33 federally qualified health centers, also known as community health centers. First, I want to thank Governor Brown, Director Allen, and the Oregon Health Authority for their inclusion of community health centers in COVID-19 response planning, ensuring greater access and equity in testing and vaccination, as community health centers serve populations throughout Oregon that have been disproportionately affected by COVID-19. Oregon's community health centers are nonprofit systems of care providing integrated medical, dental, and behavioral health services to 466,000 Oregonians at over 270 sites throughout our state. These health centers are trusted sources of quality community-based care and are uniquely positioned to assist in vaccinating vulnerable and hard-to-reach communities across the state, including people experiencing homelessness and poverty, Black, Indigenous, and people of color, agricultural and migrant farm workers, and people living in rural and frontier communities. Oregon's health centers have seen COVID-19 positivity rates of 18% among their patients, which is almost 4 times the COVID-19 state average positivity rate of 4.6%. For racial and ethnic minorities in Oregon, this positivity rate jumps to over 15 times the state national average at 71.3%. Oregon's community health centers are already hard at work vaccinating their communities and are ready and eager to increase access in partnership with our state and federal government. Vaccines have started to arrive at a handful of Oregon community health centers throughout the state, including Virginia Garcia Memorial Health Center, who you'll hear from in a moment. And in the coming weeks, we'll see an increase in available vaccine to health centers through our county, state, and federal partners. These programs will complement each other to provide increased equity in vaccine rollout. OPCA and our member health centers look forward to continuing to work with Governor Brown, the OHA, and the federal government to mount a more equitable, comprehensive vaccination program in the state that will remove barriers for those most severely impacted by COVID-19. And thank you, Governor Brown.
Thank you very much, Joan. We appreciate your hard work as well. And next up is Sarah Dynas. She is the Director of Quality at Virginia Garcia Memorial Health System. Sarah, thanks for joining us this morning.
Thank you so much, Governor Brown and Director Allen, for including us in this conversation and ensuring that FQHCs have access to vaccine. The Virginia Garcia Memorial Health Center is a nonprofit community health center with more than 45 years serving the communities of Washington and Yamhill counties. We provide medical, dental, mental health, and pharmacy services to more than 52,000 individuals each year. From the beginning of the pandemic, we have seen the devastating effect of COVID-19 on the communities we serve, especially communities of color. Since March of 2020, we have tested almost 12,000 individuals. And as essential workers, our patients continue to represent a large percentage of the population most at risk. Of those we've tested, Latinx community members made up 84% of our positive test results, but only 61% of the people that we tested for the virus. And while the state has seen a drop in positivity rates recently, our communities have consistently seen positivity rate 2 or 3 times higher than that of Oregon. Responding to the COVID-19 pandemic continues to be Virginia Garcia's top priority. We are committed to do our part to reduce the positive rate of COVID-19 in our communities. And over the past weeks, Virginia Garcia has vaccinated more than 1,500 individuals. Our clinics are increasing capacity as we have more access to the vaccine. We are working with both Washington and Yamhill counties to ensure our efforts are reaching as many individuals as possible. We are targeting our outreach to patients and county referrals for individuals working in healthcare, childcare, and education. We are also reaching out actively to our patients over the age of 75, especially those who are at high risk and with barriers to care. For others in our community seeking vaccine, we direct them to the OHA website for the vaccine location near them. We continue to explore the most effective methods to ensure our patients have access to the vaccine. Over this past year, we've brought our mobile clinic to COVID-19 testing events around Washington and Yamhill counties. We've offered COVID-19 screening to farm workers, nursery workers, vineyard workers, and those in low-income housing. We've developed culturally appropriate messaging and public service announcements aimed at providing reliable information about the virus and the vaccine to the communities we serve. And we partnered with other community organizations to coordinate resources and address other social determinants of health, such as food insecurity and housing. As soon as these groups of essential workers are eligible to receive the vaccine, we will repeat our outreach to offer the vaccine to these individuals. Our role as a federally qualified health center is to provide access to healthcare for vulnerable individuals and communities. This is a commitment that inspires us and guides the work we do. With the pandemic, this responsibility motivated us to bring COVID-19 testing to our communities early in the year, and this fact continues to inspire Virginia Garcia to provide vaccines as quickly as possible to our patients, focusing on equitable distribution of vaccine across our communities. As a federally qualified community health center, Virginia Garcia was and still is positioned to ensure that those with barriers will have access to the vaccine. And we'll continue to advocate on the behalf of our communities that we serve, and we'll partner with other organizations to provide the care so desperately needed during these times. Again, thank you for the opportunity, Governor Brown.
Thank you so much, Sarah. And please thank your team members as well. I know they're dedicated to serving vulnerable Oregonians, and we really appreciate their dedication. And with that, Charles, we're ready for questions.
Thank you, Governor. We'll get started with Pat Duras from KGW. Go ahead, Pat.
Yes, good morning. Thank you. My question, Governor, with a third of the eligible seniors vaccinated, and probably actually it's lower number than that since you had told us in the past that 20% were already vaccinated because of where they lived. So with such a small percentage vaccinated, why not pause the rolling eligibility instead of continuing to dump big groups of hundreds of thousands more and making it even harder for the 80 and 75-year-olds to get vaccinated? Thank you.
Thanks, Pat, for that question. And for that, I'll turn it over to Director Allen.
Thank you, Governor. I think, Pat, I'm not sure I quite follow your logic. 30% of people who are eligible right now have been vaccinated, some in the vaccination events we've done, some through the federal pharmacy program, but it is still 30% of eligible Oregonians who've been vaccinated. At the outset of this, the governor laid out a schedule week by week that we would make people eligible. And then we also laid out a schedule of how long we thought it would take to work through that population. And there is going to be a little bit of a traffic jam. I think there was always going to be something of a traffic jam. Remember, part of this was caused by the previous administration raising a bunch of people's expectations about their ability to get quickly vaccinated, and you know, that didn't last 48 hours before we figured out that they didn't actually have the vaccine stockpiles that they were indicating that they had. So we've been trying to clean up that mess since that happened, and giving people the ability to get in and get scheduled, and then knowing that we've got increasing supplies of vaccines to work through that population, as we indicated earlier, by at least early April, I think will help get people into the pipeline, get them vaccinated, and get them protected from the virus.
But wouldn't it reduce the stress on those already eligible if you just put like a 2-week pause and said, let's get more 80 and 75-year-olds the shots?
Well, perhaps, but I think it would also increase stress for people who thought they were going to be able to start signing up on Monday and get told that now they can't sign up. So, you know, I think that's a double-edged sword.
So, and this is for Pat Doris, not for Pat Allen. The good news is that the Biden-Harris administration has been very transparent, very honest, and working to ensure that we know exactly how many vaccines we're getting over a 3-week period. The good news is that they have been able to increase vaccine allocations to the state, all of the states, frankly, since Joe Biden was sworn in as our president. The distributions to the states alone have increased over 30% in terms of vaccinations. And they've created additional pathways by establishing the federal retail pharmacy program. As we mentioned, 1 million vaccines went to that program last week. This week, they're adding an additional 1 million vaccines to that program. Again, this is nationwide. And in addition, they set up a direct allocation for federally qualified health centers. So we are continuing to receive both very transparent and very accurate data from the federal government, and that it will enable us to continue to increase the number of people that we are vaccinating.
Okay, thank you.
Thank you, Pat. We'll go next to Lisa Balick with Coin. Go ahead, Lisa.
Good morning. Couple quick questions. People are still having such a tough time signing up for appointments because there's so many places to do that, whether it be the state, county, community health centers. Each pharmacy seems to have their own sign-up pages. Why not have a central online system to make it easier to find and sign up for appointments? Are you working on that?
So we do have a couple of statewide data points, including calling 211 and our statewide database, getvaccinated.oregon.gov. None of these allow for direct appointments. Different communities, different regions are doing vaccination programs differently. And I'm happy to turn it over to Director Allen to talk about more details, or we could have Sarah talk about what's happening at Virginia Garcia.
Let me take a quick cut at that, Governor. We did early on look at a single statewide scheduling system, and the overwhelming majority of our vaccination partners asked us not to do that. That the ways of communicating with people, the systems for setting up appointments, integration with electronic health records are so different from place to place throughout the state that a system for getting people vaccinated in Wheeler County looks utterly different from how people would get vaccinated in Douglas County, and yet different from the Portland metropolitan area with hundreds of thousands of people to be vaccinated. And if you look across the country, there are plenty of stories of those statewide kinds of systems actually just collapsing right out of the gate and not being able to actually do what you would think that they'd be able to do. It's one of those things that kind of sounds better in theory and doesn't work as well in practice. And so we've gone with the system that we have now, which is pointing people to the local sources where they're going to get vaccinated to be able to set up those appointments.
Director Allen, what's the plan to get a vaccine next week?
I'm sorry, Sarah, do you want to talk about your scheduling at Virginia Garcia?
Absolutely. I think from the beginning, we knew that our patients were going to encounter barriers to accessing platforms for scheduling that were really technically complex. And we know that our patients know how to access CareWest directly. So in order to reach our communities, we are relying on our existing system for scheduling and for connecting with the patients that we serve. And so we've certainly, within our own patients who have sought to schedule through other systems, they return to Virginia Garcia because they're comfortable with the people that they interface with to get access to that vaccine.
Thank you. Lisa, did you have another question?
Yeah, just a quick follow. What's the plan to get a vaccine next week if you do have a double shipment? Will there be extended hours or additional clinics?
I think it depends upon the vaccination site. Director Allen, do you want to fill in?
Yeah, very much. It'll depend. It's Moderna that was delayed, and so sites like the Oregon Convention Center are almost, if not completely, exclusively Pfizer vaccine. Won't be affected by that. And various vaccination sites are making different kinds of plans depending on what they did with those appointments. Often they rescheduled them, and as you suggested, things like extend hours and or add days to be able to make up for that. And it'll probably take a little bit of time in some areas to be able to work through that backlog.
Thank you.
Thank you, Lisa. We'll go next to Gary Warner with EO Media. Go ahead, Gary.
Good morning, Governor and everyone else. Wanted to find out if you have any statistics yet on the number of people who qualify, who are eligible, and are turning down the shots. We've been seeing some national reporting, particularly with nursing staff in long-term care facilities, not taking the shots, sometimes 30, 40%, even 50% in some of these places. What can you tell us about rejection of taking the shots?
Thanks, Gary. And I'm going to turn that over to Director Allen and Dr. Seidlinger. I only have anecdotal information.
Yeah, so Gary, I think the answer is the same answer as it has been the last 2 or 3 press briefings, which is there's not a good comprehensive data source to be able to track that. What you're hearing is certainly the same sort of thing that we're hearing. It's geographically variable. It's variable across different kinds of industries. For example, uptake is reported to us in Portland metropolitan area hospital employees very high, 80% or more. Same thing with residents in long-term care, somewhat lower in the employees in long-term care. Other parts of the state, all those categories are lower with uptake numbers more in the 50% range. But we don't know who's not showing up for vaccines. That's especially true in the senior population. Who's objectively chosen not to get vaccinated versus have barriers to getting vaccinated, need more outreach, and those kinds of things. And so that's the kind of thing that we're going to be able to look at the population level later, but there's not a real-time way to be able to track that.
If I could just follow up quickly, Pat, you had talked a couple of briefings ago that there were areas where they were getting ahead of the eligibility schedule because they said that they had extra shots. And the argument from these people was that they're doing better than other places. But it seemed like they were maybe getting too much vaccine for the demand. Some of that went up to Portland for the healthcare workers. Have you been able to work out that discrepancy, smooth out the numbers?
Yeah, so just to be clear, vaccine went to a number of counties, rural and urban, including the Portland area, when we were trying to make some adjustments to get more vaccine to areas that had not gotten enough doses to complete the 1A population. And what was going on is I think we were constantly serving local public health authorities asking how much vaccine they needed to get through who they thought was left. And the 1A population in particular seems to have had kind of a persistent sense of people who were previously hesitant, seeing friends and coworkers being vaccinated, seeing it turn out okay, and then showing up to be vaccinated, and those numbers kind of have continued to build. I think that has slowed down now, and now what we're focusing on is a vaccine allocation effort that is largely, though not exclusively, focused on the per capita population over age 65, since that's the bulk of who we're working through right now. And so we're trying to allocate vaccines that way, while also trying to target pharmacies and FQHCs and places that serve that target population in communities that have been disproportionately impacted by the virus.
And if they have extra vaccine, what are you telling them if you've gone through?
Well, so if extra vaccine means you've gotten to the end of the day of your clinic and you've got thawed doses, and you've run out of people who showed up for an appointment, get them in shoulders. That's what we're telling them. We don't want to see any vaccine spoiled. I think that problem is easier to manage when sites are using a schedule-based system. And I think almost everyone now is using a schedule-based system. It's a little harder when it's a kind of a walk-up clinic and you really don't have any idea who's going to be there. But at the end of the day, if there are doses that will go to waste if they're not used, we'd like them to be used.
And this is Sarah from Virginia Garcia. I want to say on our part, we're working very closely with the counties, Washington, Yamhill County, and we have from time to time shifted vaccine to and from the county to meet the need for the vaccine clinics that are on the schedule. And so I think that's where we're looking at continuing those partnerships to make sure vaccines are getting to the most appropriate people as quickly as possible.
Thank you.
Thanks, Gary.
We'll go next to Brad Schmidt with the Oregonian. Go ahead, Brad.
Hi, thank you. Following up on the issue of racial and ethnic disparities among people who have been vaccinated, how much of this is a direct result of who is eligible in phase 1A, educators and elderly populations? And when will OHA and the governor announce who will be in the next phase? And then a third part to this question is, OHA spent a great deal of time earlier today referencing federally qualified health centers as the solution to this issue. When will we begin to see significant numbers of vaccines going to these federally qualified health centers? Looking at the vaccine allocation data for the current week, it looked like Virginia Garcia was only slated to receive 1,100 doses. Thank you.
Thanks, Brad. I'll answer your second question and part of your first question, and then turn it over to Director Allen and team. In terms of when we will release the information, regarding the 1B population that will happen next week. As you are well aware, the Vaccine Advisory Committee spent a number of weeks and a lot of time and energy prioritizing equity and communities that have historically been underserved. And I really appreciate their time and energy and their incredible hard work. We are relying on that information as we build out the 1B population effort for next week, and we'll be releasing that information. In terms of your first question, I guess I have to say my work here, my administration's work, as well as the Oregon Health Authority, have been focused on tackling disparities, racial disparities in healthcare and in other areas. And obviously in vaccine distribution, it is a huge priority for us to make sure that we are focused on equity. And in part, the disproportionate vaccination rollout, 1A population, primarily healthcare workers and first responders, and obviously educators, is a primarily white majority population. So that is a factor there. I will say one of the reasons we're absolutely committed to getting to the 65 and older population is particularly that 65 years old and older population is 65 to 75 is particularly diverse. So we're very committed to moving these categories along and getting our elders vaccinated as quickly as possible. Director Allen, you want to clean up there?
I will a little bit, and maybe I'm sorry, a little bit of cleanup on the last part. The elderly population skews wider than the population overall in the state, and so all those categories that we've prioritized so far, with the exception, I would say, of workforce in long-term care, do as you suggest, Brad, and they do skew wider than the overall state population, and they drive at least some of that disparity. I think there is a lot of hesitancy in the community. It's why I hope I didn't say that FQHCs are the solution. I think they're an important part of the solution for this, because they've got those relationships that help overcome those hesitancies and other barriers to being able to be vaccinated. We talked a couple of weeks ago about targeting the federal retail pharmacy program at locations that serve zip codes or census tracts that have high COVID community vulnerability index scores to, again, kind of accomplish the same thing. What I think you'll see happen over time is, as the supply of vaccine continues to increase, and as we move into more diverse populations, we'll continue to look at where we're allocating the vaccine. When we start opening up to people with pre-existing conditions and frontline workers, those populations skew the other direction. And so just by simple virtue of who's eligible, we'll begin to be able to start addressing that. But having a diversity of partners that serve those diverse communities is also going to be an important part of that.
And if I could just follow up, what is OHA's commitment for allocating to federally qualified health centers? Again, as I referenced, it looked like Virginia Garcia is getting 1,100 doses for the current week, and obviously those didn't all arrive because Moderna has had the delays. I mean, it's going to take a long time to make up the disparity gaps that you currently have if some of these centers aren't getting more doses, is it not?
Well, we're going to want them to get more doses, and I'm sitting here drawing a blank on the exact number that's going to the FQHCs collectively, both from the federal direct program and from the state program, and we'll go ahead and follow back up with that. But again, FQHCs are not the only answer to this issue. The mix of who's eligible, the outreach done by local public health, which focuses on these same populations, the diversity of locations, the selection of locations for the pharmacy program, those are all tools that try to aim doses at more diverse populations.
Thank you.
Thanks, Brad. We have time for just a few more questions, so we'll go next to Genevieve Riom with K2. Go ahead, Genevieve.
Thanks, Charles, and thanks to Governor Brown and OHA for this press conference. I have a few quick questions here. The first one is, what is OHA doing to ensure people who are disabled, homebound, or live in rural areas can access the vaccine?
Thank you, Genevieve. Director Allen, do you want to tackle that one?
Yeah, that's a primary charge to local public health to work on identifying what their most at-risk and vulnerable, challenged populations are, to be able to design whatever the right, or make use of whatever the right tools are to reach those folks. Mobile vaccine clinics, our emergency medical services contract for mobile vaccines, using partners like Virginia Garcia and other FQHCs. That will look different in each county because the populations are different and the barriers are different. But that's a primary accountability for local public health.
Okay, and then, sorry. It's been almost 4 weeks since Oregon's 152,000 educators became eligible for the vaccine. How many of those educators have been fully or partially vaccinated?
Director Allen?
We think there's about 2 to 3 weeks worth of allocation of vaccine to go to get through the rest of that population. It's a little bit hard. We don't, again, because we don't have a system that tracks occupation to comprehensively track that. But as we work with local education service districts and local public health and identify who they think is left, we think that's about the pace that remains.
Thank you, Director Allen. And this one is for Governor Brown, a follow-up to that. But we know some schools won't start in-person learning until their educators have access to their second shot. Governor Brown, what are you doing to ensure these teachers are getting access to the shots right when they're eligible?
Well, thank you, and really appreciate the level of coordination with school districts around the state, with local public health and other partners to make sure that our educator workforce gets vaccinated as quickly as possible. We are working on the front lines to make this happen. Obviously, with the weather that happened this week, it made for challenging circumstances for us to get vaccinations out to those that were eligible this week, but we're going to continue to work as efficiently, as equitably, and as quickly as we can to make this happen. Really, really pleased to see school districts around the state moving to in-person learning. As you're probably aware, Salem-Kaiser will be starting the first week of March with elementary students. Ben Lapine, Springfield, others are bringing their students back in as their educator workforce gets vaccinated, and really appreciate the community collaborative effort working to make this happen.
Thank you.
Thanks, Genevieve. We have time for just one more question. So we're going to go to Jonathan Bach with the Portland Business Journal. Go ahead, Jonathan.
Hey, Governor Brown. Thanks for holding this press conference today. I had 2 questions, pretty brief. The first is, have you or any of the state leaders on this call been vaccinated yet? And then the second one is a little bit more complicated. I wanted to talk taxes. So the federal stimulus money can raise the amount of state taxes that residents owe because of the federal tax subtraction that Oregon allows. One example from the Legislative Revenue Office last May showed that a joint taxpayer with 2 children and $3,400 in stimulus money could essentially have a tax liability of about $298. Senator Dick Anderson, a Republican, recently said there is no justification for the state to be taking some off the top. How do you respond to his comments, and why should the state collect more personal income tax revenue because of these federal stimulus checks?
Well, the Department of Revenue, Jonathan, is following the law, and I expect the Department of Revenue to follow the law. The legislature is currently in session, and Senator Anderson, along with his colleagues, should, if they feel strongly, should introduce legislation to change the law and prevent that from happening. In terms of vaccinations, I can't speak for anyone else on the call, but I have not been vaccinated yet. Director Allen?
I am not eligible yet, and so I have not been vaccinated, but as soon as I am eligible, I will be. Dean?
Thank you. I was in line at the convention center yesterday for my appointment and received my second vaccination. Some of our public health staff, particularly those who have contact with the general public, our testing teams, our staff at the Oregon State Public Health Lab, some of our physicians and clinical staff who can aid in those testing events and vaccination sites have been vaccinated and are included in that public health workforce with frontline facing jobs. So we are following it, and I was very happy to receive my vaccine yesterday and very happy that I didn't have any side effects, so I'm able to be here with you today.
Thank you so much, Jonathan. And Charles, back to you.
Thanks, Governor. We have time for just one more question. So we'll go to Kristen Severance with KGW. Go ahead, Kristen.
Thank you so much. This question is about adult foster homes. I've been talking to adult foster homes all over the state for the last week. They are having such a tough time getting answers on when they'll get the vaccine. They call local public health. Public health has no idea really what to tell them. You know, places like CVS has canceled. What do you say to these people? There are 1,200 facilities still waiting who really feel left behind in this process.
Thank you, Christian. Really appreciate the question. We're working as hard as we can to get vaccines to these facilities. Director Allen can fill in the details.
Yeah, thank you, Governor. These are facilities that we had been led to believe by CDC were eligible for the Federal Pharmacy Partnership Program, and in fact had been signed up. As you indicated, they were signed up and many of them were canceled out of the program. We spent the first 2 or 3 weeks of the vaccine rollout basically trying to argue with CDC about that point. And at the point that we discovered that we were getting nowhere, we entered into contracts with various vaccine providers, including, I believe, Safeway Albertsons, to begin working through that population. It has been a scramble to try to cover these folks, not having expected to have to at the beginning. And so it is a little bit difficult right now for them to find out what the details are, but they will get vaccinated. We will ensure that every one of these adult foster care facilities gets a visit and is able to schedule vaccinations. It's just going to take us a little bit.
Thank you.
Thank you, Christian. I am going to close this out now. Director Allen, thank you for your leadership. Dr. Seidlinger, Joan Watson-Patko, the Executive Director of the Oregon Primary Care Association, and Sarah Dinas, Director of Quality at Virginia Garcia Memorial Health Center. Please, thank you for joining us today. Really appreciate your time and energy. Also want to say thank you to Senator Margaret Carter for allowing us to video her while she was getting vaccinated. Please stay safe out there. Please stay warm and take care.